a little off, right? And you got me now. Well, ladies and gentlemen, let me apologize. I am in Chateaubelair, and I decided that it would have been impossible for me to have driven back to Old Fort Kittels to do the program, and that I would do what's called a StreamYard from Chateaubelair, from Beachfront Restaurant, where I have had a wonderful bowl of cook-up soup. And I think that that kind of took up my time. It was delicious. So I wanted to do a program this evening that was more geared to the time in terms of the political situation, health and politics. But I'm going to put that off until next week. I'm going to talk about a number of things. But today, even though we've started late, I want to touch on the subject of a stroke. Now, trying to get my various devices connected, I just couldn't get them connected. And finally, I had to use the old method of creating a hotspot with my phone and allowing my laptop to access the internet through my hotspot created by my phone. So it's really fascinating technology, and I've got all sorts of other phones, and so couldn't get them working today. I want to talk a little about strokes. And last week, I got a call from someone, who's interested in the subject of obesity. How do you manage obesity? I'm still gathering some information to be able to get to that person, and I will get it to you. But this evening, I want to talk a little about strokes. And I want to talk in particular about strokes in women. And so let me say, strokes, oh gosh, we're talking about the brain. And you should know that in your heart, in your chest, there's a heart, and it pumps blood to the rest of your body. But it has some special blood vessels called the carotid that run up, one on the left side of your neck, the other on the right side of your neck. And those blood vessels, they send off all kind of smaller blood vessels, some that feed your face, your eyes, the other things like that. But the bulk of the blood is going to your brain, inside your scalp, inside your skull. And your brain needs the blood. It needs the blood to bring oxygen, nutrients. It needs the blood to bring all sorts of other things that are necessary to keep the brain functioning. And the brain is the center of operation, not so much the heart, the brain. And your brain is going to control your vision, your smell. It's going to control your taste. It's going to control a host of functions, your movement of your arms, your movement of your legs. And without your brain, you're in big trouble. You're in big trouble. So the supply of blood and nutrients and oxygen to the brain is crucial. It's one of the most important functions of your body, And we say you're not really dead until your brain is dead. I hate to say that, You could lose different parts of your body. Your arm could get cut off. We could take out part of your liver, take out a kidney. Can't take out both. What we can do and do put you on a machine. But really, your brain, I haven't heard of many brain transplants or attempts at really doing it. I've tried. But the brain can become damaged. And there are lots of things that can damage the brain, but we tend to feel that the main thing that can damage the brain is a stroke. Now, you can have a cancer growing in the brain. Or you can have a cancer from one part of the body that will travel up to the brain and start to grow and damage the brain. Somebody could hit you over the head and cause a bleeding inside of the brain. That's not a stroke. That's trauma. You could get into a road traffic accident and go through the windscreen, in a head-on collision. Your brain would be busted and be smashed. But what I'm talking about is a stroke. This happens when the blood supply going to the brain is interrupted. And let me tell you a little bit about symptoms of a stroke. Stroke symptoms include a sudden onset of maybe confusion, trouble speaking, numbness or weakness in the face, the arms or legs, and this is usually on one side of the body. Vision problems and difficulty walking or dizziness. A sudden headache can sometimes occur with a stroke. With no known cause of the headache, no one's hit you over the head, you just start having headache. And it can also be a combination of these things. Now, if any of these signs and symptoms occur very suddenly, it is crucial that you get some urgent care, some emergency care, because these things can be indicative of a stroke. And with strokes, a stitch in time can save 9. We can reverse a stroke. We can avert a full-blown stroke. We can turn what is going to be a major stroke, a bad stroke, into something that's a bit more mild that you could recover from. So let's look at the common symptoms, as I said, of stroke. This sudden numbness or weakness, especially on one side of your body. Because why I'm saying this is that the blood vessels coming up your neck can become blocked. The blood vessels coming up your neck, supplying your brain, can become blocked. And the blood vessel on this side supplies half the brain, and the blood vessel on the other side supplies the other side of the brain, right? So if this blood vessel is blocked, well, you're likely to have a problem where this part of your brain cannot get the oxygen, the nutrients, and the nerve cells can become damaged and die. If you have a problem with this blood vessel coming up here, this side of the brain can become damaged, and we can have problems relating to which part of the brain is actually damaged. And when I say damage, the blood supply could become blocked off. Or, guess what? The blood vessel, after it gets into the brain, can actually burst. The blood vessel could burst, allowing bleeding into the brain. These are two different types of strokes. One is called a bleeding or hemorrhagic stroke, right? Where a blood vessel breaks and blood leaks into the brain, damaging that side of the brain. Or you can have a blockage, an occlusion, that they call it, a blockage type of thing, where the blood vessels have become narrowed by fatty tissue and other things like that. They could also be a clot that can travel and block off, the blood vessels. But all these things can lead to different types of strokes, a sudden type of stroke. So this major symptoms of weakness of your body, weakness of your face, weakness of your arms just falls, your legs, you could fall and collapse because the stroke has damaged a part of the brain that controls the movement of your arm, that controls the movement of your leg, right? You can have a sudden vision problem. If the part of the brain that controls the eyes is damaged, you can have a vision problem. Trouble with seeing in one eye or even both eyes, or you can start seeing double vision, right? Now, trouble if you've lost the function of one side of your body, you're going to start having problems with movement, walking, and balance. You could lose balance, as I said. You know, lack of coordination. You can't pick things up. You can't do anything like that. And then a big form of is a headache. Now, everybody who has headache doesn't mean they're having a stroke, but some people with strokes can have a severe headache, especially if a blood vessel is like breaking or bursting and blood is leaking out. Well, that's going to cause a headache, you know? And, you know, a severe headache, I should say, without any other cause. No one's hit you over the head. Now, persons who have high blood pressure, I want you to understand that the high pressure can cause these blood vessels to eventually pop, just like a pipe. It's like a pipe in your backyard where at night the pressure is very high and it starts to leak. Have any of you ever turned on the tap at 12, 1 o'clock in the morning and a whole big gush of water comes out? Well, consider the blood vessels going up to your brain having that kind of high pressure. And as a result, if some of the blood vessels are not strong enough, they can break and cause bleeding into your brain. But the majority of strokes really comes from these blood vessels on either side becoming blocked, becoming narrow, not allowing blood to flow through. And that is causing a problem. Now, you can also have other symptoms such as nausea, vomiting. I mentioned double vision, drowsiness, a weakness in general. Some people have chest pain, and you can have fatigue. So all these kind of symptoms, a stitching time saves 9. Call the ambulance, call the casualty. You need to get to the hospital very, very quick. So do not drive yourself, because if you're having a stroke, you are going to probably end up running off the road. Have somebody try and get you there, or get the ambulance, if the ambulance can get you there quickly. Strokes, heart attacks, we now realize if you could get to a doctor in 10 to 30 minutes, your life can be saved. That whole stroke and so forth can be averted. You know, because when a blood vessel gets blocked and oxygen and nutrients are not reaching a particular side of the brain, you know, those cells, those tissues of the brain can't handle that for very long. But if we could intervene very quickly, we can reverse that. Those cells, the tissue of the brain, can survive. Now, stroke symptoms in women can include some of what I've mentioned to you, such as the face having a weakness, the face drooping. If I could do that on camera, the face drooping. Here we have your smile being a little bit like this. You know, one side of your face is up, the other side of your face is down. And that is characteristic of a stroke that affects the face. It naturally is going to can affect your hands and your legs, right? And women too. And arm weaknesses and speech can be difficult. And in general, a stroke in women can be considered to be virtually the same as that as a stroke in there. But it's important that we act fast. Now, um, it would seem that women are more prone to strokes. Men have strokes too. And to tell if the face is really drooping, you ask the person to smile. Now, I'm going to smile in front of you. And you notice I have a symmetrical smile. Whereas if you ask someone with a stroke to smile, they'll smile, but one side of their mouth hangs down. One is up, one is down. I'm not naturally having a stroke. So you could ask them, is your arm weak? And they may have problems holding up their arm. They have problems holding up their arm. You could ask them, does you have problems standing up or walking? And they will definitely show some signs of walking. Now, they don't have to have all these things. You can have just the weakness of your face. You can sometimes just have the weakness of your arms. You can have the weakness of your legs. You can have all of them. Now, speech is often difficult because the voice box, the speech, the muscles of the face are all important in speech. And when somebody's having a stroke, they have difficulty speaking. It's not only that part of the brain that controls speech may be affected, but that the muscles around the mouth, the tongue, everything, the voice box, all these things may also be affected too, right? Now, the additional symptoms, more common in women, I want to go through. Sudden numbness or weakness in the face, and legs on one side of the body. This is more common in women. Sudden confusion or trouble speaking and being able to make understandable speech. Sudden trouble seeing in one or seeing from one or both eyes. Sudden trouble walking. Sudden severe headaches with no cause, as we've mentioned before. Now, and there's a tendency to have a little bit more nausea, sometimes even vomiting, shortness of breath, or chest pain, or hiccups. Hiccups, yes, hiccups can occur. Now, why do people have strokes and how do we handle them? I've mentioned to you that the heart pumps blood up to the brain. If the heart is going through its own problem, such as a heart attack, or the heart is beating funny, somehow it's not pumping enough blood up to the brain. And that's a serious problem. The strokes can occur that way. If the blood pressure is very high, as I mentioned, it can blow out a blood vessel inside the brain on one side or the other side, sometimes both. And the bleeding inside the brain, can distort the brain, damage the brain tissue, and in that way cause a stroke. We call a hemorrhagic stroke. But the vast majority of strokes, as I've mentioned, are caused from blockage in these blood vessels. Blockage in these blood vessels. And the blood vessels are going to, in some way, prevent the blood from getting up. Usually, it's on one side of the body versus the other. You don't, blockages are taking place in both sides at the same time, but it's uneven. And so one side, the blood vessels on one side can become more blocked than the other. And that's where you're likely to end up having a stroke. Now, how we treat this depends on what type of stroke it is. If the blood pressure is high, we really want to see how we can bring down the blood pressure. We may not want to bring it down suddenly, but we want to bring it down. And if there's been a bleed inside the brain, we need to allow that blood to kind of dry up. There are a number of things that we can do. We usually put up a drip. We can give certain chemicals inside that drip that tend to dry back out the blood from the brain. But in general, what the blood is doing from a bleed is to separate your brain tissue. And as we mop up the blood a little bit to a great degree, what that's going to do is to allow the tissue to get back to in its normal shape. That may take a while, but there are things that we can do to do that. And getting somebody into a hospital, into an intensive care unit, is where that sort of thing is done. You know, and we're able to monitor the person minute by minute, hour by hour, day by day, and see how we can get them stabilized. And on the other hand, if a blood vessel is blocked and blood is not getting to that side of the brain, then it depends on how much damage there is. If a lot of the brain has been denied getting blood and oxygen and so on, that's not good. So usually when a person is stroke, we want to give them oxygen. That might help getting more oxygen up to the brain. We again put them on drips. And we may even try to thin out their blood a little bit. By thinning the blood, it may allow blood, as it's thinner, to reach the tissue. What's happening here is that there's potentially clottage, there's blood clots and so forth that's preventing blood. There's a traffic jam. And by thinning out the blood, making the blood thinner, by giving you medications that can thin the blood, call them heparin, a number of other things we have today. But we can thin the blood, and hopefully the blood will reach at the tissue, and hopefully it hasn't been too long, too late for the brain tissue to get back some livelihood and some survival, as opposed to that brain tissue dying or becoming injured because of a lack of oxygen and nutrients and blood getting to it, bringing those things. It's a matter of time, whether it's a blood vessel that has broken and you have a hemorrhagic stroke, or whether it's a blood vessel that's blocked with a clot in terms of a occlusive blockage type stroke. We handle these two things differently. Now, for sure, if you have a bleed, you don't want to give blood thinners. It's not going to make it bleed more. You don't want that, And at the same time, for blockages, you want to really act fast, and you want to know. Very often, the patient, we take them straight to a CAT scan to see what type of what type of problem there is, and a CAT scan or even an MRI could tell us a lot about what's going on and tell us the extent of the damage. And we can then fine tune things with certain special medication and other things like that to really see how we could clear things up a little bit. But strokes are some things that are difficult to survive. It's nice if you have what's called a mild stroke. When people have a severe stroke, it usually means that maybe in a matter of a few days, even though they're in the intensive care unit, that they may not survive. But a lot of people have recovered from strokes. And if you have recovered from strokes, you don't want to have a second stroke. You don't want to have a second and a third stroke, because this just really causes more damage. And you have to get into the art of not only preventing the stroke from happening in the first place. If you've had a stroke, your lifestyle has to change. If it's blood pressure, diabetes, high cholesterol as causing problems, then you need to get these things fully under control. If, on the other hand, it is just that your blood vessels are getting blocked because of all the fiber fatty tissue. Let's say your cholesterol has been high and your diet, the stuff you've been eating stuff that's causing a whole set of products to be deposited inside your blood vessels. Sometimes, long before we can tell if there is problems developing your blood vessels. Like, I have my stethoscope with me. Brought it down to Chateau Belair today to check someone out. And what the doctor will do, the doctor will actually put the stethoscope on your neck. And what he's doing, he's actually checking to see if he can hear some sound, like this usually indicates the blood passing through and narrowing of big blood vessels carrying blood to the brain. We can do other tests. We can do a number of other tests, such as ultrasound, or even blood dyes tests that could show how much blockage and narrowing of these blood vessels there might be. And I'm so hopeful that even though we're able to do some of those tests now, at the acute referral hospital being constructed at Anna's Vale, these are the sort of tests that should be done. When I practice in the United States, some of my patients who had high blood pressure but high cholesterol, I would send them to do some ultrasound, what we call a Doppler of the carotid, to see if it was getting narrow. If it was narrow, I might not do anything. I might repeat it again after 6 months to see if it's getting narrower and narrower, because some of these patients, we sometimes even put them on some other type of milder blood thinners, whether it's aspirin or whether it's a series of other medications. I'm not going to mention their names, right? That can also thin out the blood a little bit and allow for greater, easier flow of blood towards the brain. Stroke is a very serious matter. A very serious matter. And for people who have been highly active in their lives, stroke can leave you in a situation whereby someone has to take care of you, a family member. If the family members are not available because they're working, then you may have to go into a home. You may have to go into a facility, a medical facility, where nurses or nursing assistants are taking care of you around the clock. You know, you after a stroke and you have weaknesses, you can have rehabilitation, physical therapy to strengthen those muscles and learn back how to walk, learn back how to get things done. You know, go back learn back how to get things done. But it's gonna need your involvement. It's gonna need your participation. A stitch in time is gonna save nine. A stitch in time always saves nine. And um, you know, strokes are not always fatal. Matter of fact, they're hardly fatal, right? If they're massive strokes, they can be fatal. Now, Kamal, I don't know, have we had any texts or any potential questions or so? I know we started late. A lot of people may have thought that I'm not on the program this evening.
Yeah, I almost thought that I lost you as well, but no, we don't have any questions or anything so far.
Yes. Well, you know, I am gonna forecast what we're gonna be talking about. We'll be talking about health care in St. Vincent and the Grenadines, and you know, certainly a lot of things are being said about hospital, selling of a hospital, and selling shares and so forth, privatization. I think that this is something that I need to weigh in on next week, next Wednesday, right? But in the meantime, Kamal, I'm gonna bring the program to a little premature halt. I know we still have about 9 minutes left, but I as I started late, I wanted to go on a lighter subject and to try and get all the persons who may be listening or who will look at this program to really start to understand the whole subject of strokes. Once again, there can be a hemorrhagic stroke where blood vessel breaks inside the brain and blood leaks out, pushing away tissue, damaging tissue. But we can kind of mop that, we can sponge up that blood, and the tissue could kind of go back down to normal by various means if things are done quickly and early enough. On the other hand, if there is a blockage of the blood vessel and blood cannot get to the brain, oxygen, nutrients can't get to the brain, that's big trouble. That's the majority of strokes. But 80% of strokes are like that. You know, there's some other forms of stroke where there's some blood vessels actually inside the brain that themselves break. That's another form of hemorrhagic stroke. But the main thing is that when blood vessels start getting blocked, we can slow the process of them becoming further blocked by your doctor intervening, testing, and so forth very early, preventing the blood vessel from getting further blocked and so reducing your risk of stroke. If you do have a stroke from blockage, you can still be dealt with, you can still be helped, but prevention is better than cure. Ladies and gentlemen, I'm glad speaking to you this evening. Sorry it was a little late, a lot of technical problems. I'm in Chateaubriand at Beachfront Restaurant. I'm gonna be down here just for a little longer. Then I want to wish everybody a very pleasant good evening, a wonderful week. Stay healthy. Your health really matters. Thank you very much.
Your health matters.
How much do you know about what makes up a healthy lifestyle? How do you define good nutrition?